Hello friends, in this video we'll talk about inguinal canal, Hesselbach triangle and applied aspect, that is the inguinal hernia. Okay, alright. So first about the inguinal canal. So we'll see first the surface marking. So 1.2 centimeter above from the inguinal ligament we are finding this cylindrical canal, that is the inguinal canal, which is having the superficial and deep inguinal ring. Okay. Now let us see the structures that pass through these rings. When it comes to deep, we'll see in the male and female. In the male, we are finding the ductus deferens, the testicular arteries and veins, processus vaginalis, genital branch of genitofemoral. This nerve supplies what muscle? Cremaster. Okay, so I'll tell you in detail about the cremaster later. Then autonomic nerves and lymphatics. In the female, we are finding the round ligament of uterus, obliterated remains of processus vaginalis, and the lymphatics from the uterus. Coming to the superficial, in the male, spermatic cord. In the female, same round ligament of uterus. Ilioinguinal nerve will be there. So remember here in the superficial, ilioinguinal nerve will be there in both the sexes. Difference will be in the male spermatic cord. In the female, we'll find the uteral round ligament. Okay. Let's see the boundaries of the inguinal canal. Boundaries and contents. First, the boundaries. These are the anterior and the posterior sides. We are finding first the superficial and deep inguinal ring. Then this is the parietal peritoneum. Okay. Inferior epigastric artery. This is the umbilical artery. The fascia transversalis covering the three muscles. I already told you. The conjoint tendon. The external oblique with the aponeurosis. Then inside the superficial inguinal ring, we are finding the external and internal spermatic fascia. Between that, cremastric fascia is there. This is the dartos muscle and outer skin will be present. Okay. Let's see the roof and floor. Roof is the fascia transversalis. It was covering three muscles: external, internal oblique and the transversus abdominis. Floor is formed by the inguinal ligament and the spermatic cord. Let us see the contents of inguinal canal. Please remember, in the male and female, I already told you, ilioinguinal nerve is common. Difference will be the spermatic cord in the male and the round ligament of uterus in the female. Let's see the transverse section of the spermatic cord. You are finding that we are finding the external and internal spermatic fascia between the cremastric fascia. That blue color line is there. Okay. And here we are finding the processus vaginalis, the testicular artery and veins. Then this is called the sympathetic nerves. Here at the center, we are finding here the pampiniform plexus. Okay. The ductus deferens surrounded by the lymphatics and the ductus deferens. Okay. This is the pampiniform plexus which is surrounding here and here in blue. This is the artery supplying that. This is the genital branch of the genitofemoral. This is the ilioinguinal nerve, the cremastric nerve and the vessels. This is about the spermatic cord. Next, let us see about the Hesselbach triangle, the boundaries and contents. First, the boundaries, automatically the contents you can see. We'll see the lateral, medial, inferior and the floor. Lateral, you are seeing the inferior epigastric artery, this red color. Okay. Medial, you are finding the rectus abdominis. Okay. Inferior, you are finding inguinal ligament. Inguinal ligament will be there. Okay. And floor is covered by peritoneum, extraperitoneal tissue and the fascia transversalis. This is Hesselbach triangle. Let us see with the inguinal hernia, indirect and direct. What is the difference? No need of this internal ring occlusion test. Please no need to write this. Rest all is important. First, let us see the site of protrusion. Indirect will be deep. Direct will be the posterior side of the inguinal canal. Shape for indirect pear shape, direct will be globular shape. Here remember G for globular, okay? And extent, which is mostly scrotal, indirect, remember. And direction, it will be straightforward in direct. Direct means straight away. There is like, there will be a straight road. There will not be U-turn, there will not be left side, right side, nothing. Just like a straight road, okay? Indirect will be oblique, like there will be like, once we go straight, there will be a left, right, U-turn, okay? There will be up, down, like that. That is indirect, okay? The neck of the hernial sac, it will be narrow and lateral to the epigastric vessels, opposite in the direct, okay? And reducibility, which is reducible, direct, remember. And age group, in young age, indirect hernia happens, direct occurs in the middle and the old age. Okay, these are the differences. Here you are seeing the indirect inguinal hernia. This is an incomplete one and this is a complete one. What is the difference you're seeing here is the incomplete will have a bulge in the left groin. This is the groin region. Okay, remember I told you line of Schultz, axilla to groin, that's where it is. This groin region, there we are finding a bulge, but it will not extend to the scrotum. But in direct, scrotum is affected, there will be a bulge. So just remember this difference. Scrotum will be affected in the complete inguinal hernia, not the incomplete, okay? This is very important difference. So references from where I took the pictures. That brings us to end of the video. So thank you so much. I'll see you in the next video.